Namaskar. Welcome to Ek Samvaad at Arunima Ankuran. Today we are in conversation with Dr. Sudhir Bhate, a pioneer cardio-thoracic surgeon. It's such a pleasure and privilege to have you here, sir. Thank you so much for joining in.
Sure.
Dr. Sudhir Bhate has an MBBS, MS in general surgery, MS in thoracic surgery. He's a consultant cardio-thoracic surgeon, and we are really honored that he joined us today for this Samvaad at Arunima Ankuran. A word about Arunima Ankuran. It's an initiative for positive social change through self-development. The goal is greater well-being and happiness for all. At Arunima Ankuran, we believe that each person is unique and special in some way, that each person can make a contribution, that each person can make an impact, and that's what keeps us going. So, a good doctor's comforting and reassuring words are sometimes more powerful than medicines. To be a great doctor, you must understand both of these hearts. And who better than Dr. Bhate to talk to us about this? Sir, thank you once again for joining in, and do take us through the milestones of your journey, please.
Yes, you can all read. It's already there. Well, I happened to secure first grade in final MBBS examination in 1965, where I secured about 8 credits and BC Royal. Then I completed my general surgical training in Pune, where I did general surgery in 1970. And then at that time, I had an accidental meeting with one Dr. Parulkar from KM Hospital, Bombay. It was a chance meeting, and during that meeting, he asked me to come to Bombay to work in KM Hospital. As you all know, is a very well-known hospital in Bombay, where they started cardiac surgery. So I went there, I got a post of senior registrar in cardiac surgery, and then Bombay University started first degree program in cardiothoracic surgery. It was a super specialty program. And I happened to be the first student to appear for the exam. So after 3 years of training at Bombay, under the guidance of my teachers, Dr. P.K. Sen and Dr. G.B. Parulkar, I got my MS thoracic degree in 1973. That was just completion of my training and graduation. But the important point was I had to start doing my practical work and my professional career. So for that, I came to Pune, which happened to be my own city, which I liked very much. And after 3 years trying to get an attachment to a hospital where I could do cardiac surgery, I succeeded in 1976 to get an attachment to a government hospital known as Pune Chest Hospital, where I became a heart surgeon. And that gave me a good anchorage to perform various cardiothoracic operations and do a lot of good things for poor patients, because this hospital is a public hospital where patients all over Maharashtra used to come. So I did about 4,000 different heart, lung, and vascular operations. I did my work, and my work paid me. I got felicitation from Pune Corporation for doing more than 2,000 heart surgeries. I also received Rotarian Excellent Award. I simultaneously worked at Ruby Hospital, which is a multi-speciality corporate hospital, where I started doing surgery in 1976, and I was working till this hospital in 2020 when the COVID came, and then I discontinued my professional career at the age of 79. I happened to be a teacher for MCH cardiac surgery when I was at Pune Chest Hospital. And during my stay there in 25 years, I trained about 14 students in cardiac surgery. All of them are now well-established cardiac surgeons. Two of them are in USA and rest of them are in India. I also, I was also a teacher in DNB cardiac surgery at Pune Ruby Hall. That was 2004 to 2018. And during that time, I trained about 7 students. So this is, in short, is my resume as I started my career in 1976, and 2020, I said goodbye to my career. I was very happy what I could do in this 45 years of my practice.
Wonderful. My God. It's so amazing just to listen to the milestones of your journey, sir. And you said that, you have a special interest. Could you talk to us about that also?
Yes, during this 25 years or more than 40 years, I developed liking for doing heart valve surgery. It always a challenging surgery, and most of the bulk of the heart surgery that time used to be heart valve surgery. It changed when coronary bypass surgery became more prominent. So heart valve surgery, second surgery, many patients nowadays require redo surgery or second surgery, which I started doing way back in 1995. Until then, we have done more than 50 cases. And the third is a very challenging and very difficult part of the heart problem. It's called as surgery for aortic dissection. Now it is increasing everywhere, even in India, and it's supposed to be because of blood pressure, diabetes, and other things. The aorta gets torn inside, and it becomes an emergency treatment for that particular patient. So, first aortic dissection I did in 1999, and then that patient survived more than 15 years. Since then, I have done more than 52 aortic dissection, and I like that challenging surgery. It is quite challenging. There are a lot of failures also, but without surgery, patient has no chance to survive.
That's very important for us to know.
Yes. So this is what my special interest.
Thank you for sharing, sir. Not all angels have wings, some have stethoscopes. So I think thank you for saving so many lives as you've done in the course of your career. It's so amazing just to, hear someone talking about complicated surgeries, saving lives. We'll talk to you about your life, and let's start with your school days. What are some of the memories that have stayed with you?
Oh, I have wonderful memories, and I really love those memories. My schooling was in a village like place called Talegaon. It's on the Bombay Pune track. It's a very beautiful place throughout the year. The weather is very just very nice. Climate is nice. It is hilly area around. So a lot of things to do: trekking, swimming, and walking around. But my school was a very small school. And what I liked about my school was our teachers there were very dedicated teachers. So what they inculcated in us was service, be a good person when you get educated, and do always good to others, and always have commitment to society. So those virtues, I must say, I learned in my school, and I'm very proud that those teachers gave us practical demonstration because they were hardly getting paid. It was a school in the village. Most of the boys and girls coming from a very low economic strata. So paying fee was also then a very difficult task for all of them. But in spite of that, though difficulties, our teachers never ever force anyone to leave the school or bring the money. They continued to give them school and showed an example that you can do sacrifice and you can do a better work. So my school memories are very good. I have some very good friends. We come together at this age also, and we share those golden memories. So school has a very special place in my heart. After this school, uh, I got like in SSC examination. My school was expecting me to do very well in the SSC board exam, but unfortunately, I did not succeed. I was not in the merit list. I did not get any special prize also. That very much discouraged me, disappointed me. And I thought that I must do something now that my teacher and my school will be proud of me. So when I joined Ferguson College, we college has recently introduced new curriculum. So there was pre-degree and pre-professional, and they were supposed to be very tough courses. But I fortunately got first class in pre-degree, pre-professional, and my entry to medical college was very easy. And that began my medical career. So it was my childhood, my school days, and my college days. All were very pleasant and very nice.
Is there a particular story from your school life that has connected you to the heart in some way?
It's very difficult to tell any story, but I can tell one more one story that I always tell to everyone. We had a boy in our school, and he was a case of heart disease, which is called as congenital heart disease. That means the child was born with heart disease. So as he grew, he became blue, and he was very rickety. He was not able to walk, but he was very intelligent. And he had a desire to continue study. He was coming from poor family. He was living about 1 to 2 miles away from the school. So one of my schoolmates, he used to go to his house, put him on the bike, and bring him to the school. And used to take him back to the school. This he did for 2 years, and after 10, he could not continue his SSC, and he succumbed to that disease. It was a very sad blow to all of us because he was very jovial and very intelligent boy, but he could not live because of his heart disease. So that showed me how one can help and one can do a change in the life of another person. I was in 10th standard and our teacher gave us a topic to write essay on body. Now, mind you, we were just introduced English in standard 8. And our English was, suppose you want to write cow. Cow is animal, cow has four legs, one tail, and cow mews, cow gives milk. This was the level of our English. To write an essay on body, what you are going to write? But I decided I must write essay in such a way that at least my beginning should impress the teacher. And you should show that I made some efforts to write this essay. So then when you need some help, you go to your dad. My dad was doctor. And I asked him, Dad, can you tell me how I should begin my essay about body? So he looked at me and said, well, I recently read some article and I think those lines are very appropriate for your essay. So I asked him, what are those lines? He said, how indispensable it is to keep the body clean, in which heart itself is God. Clean. So, body is a temple, and the God is there in the form of heart. And you must take all the precautions of your body to keep your heart, your God, always pleased. So I thought those lines were very remarkable and very impressive. And my teacher did like to say, and I got done my essay. Teacher read out and said, just look how the essay can be started. It's a nice story that I always remember.
So, sir, during your career of so many years, when you started in 1975, what were some of the challenges that you had to face as a surgeon getting into this territory?
Yeah, it was really a great challenge. Challenge in the sense there's a lot of frustration. When you become a cardiac surgeon, unless you have an institutional attachment, you can't do cardiac surgery. Private hospital, you can't have private hospital because it is very expensive. It requires tremendous staff, logistics, and everything. So I was trying to get an attachment to a hospital where I can be a cardiac surgeon. In Pune, fortunately, there was a chest hospital which was treating patients of tuberculosis because in those days, in 1975, tuberculosis was rampant and a lot of patients used to need treatment. So they used to come to Pune Chest Hospital for treatment. So there used to be a surgeon who used to do lung surgery, not heart, lung surgery. And there was one post vacant, which is lying vacant, which is not occupied. So I applied to the government saying that I'm a qualified cardiothoracic surgeon. I can do heart surgery, lung surgery, and vascular surgery. And I think this post is lying vacant. So please consider me for this post. But there are lots of factors if you want to get that post. You have to have some political weightage. You have to have some influence. You should be able to give them some money. I was not able to do anything of that because I had no political connection, I had no money, and I was going from pillar to post asking for help. But there was a gentleman, I must name his name because he's a very famous surgeon in Pune. He's an orthopedic surgeon, Dr. Sancheti. And he was my teacher also. So when I told him my story that, sir, I'm doing like this, but every time I've got some problem, somebody puts influence and they cancel whatever decision they have made. So what can I do? So he said, all right, you write to Chief Minister. So I wrote a long letter to Chief Minister that these are my qualifications, this is my experience, this post is available, but I'm not getting it. Fortunately for me, after 3 years trying to do this, Chief Secretary, that time, read my application. And then he said, you come and meet me. So that time, Dr. Sancheti came with me. We went there, we had an interview with him, and he said, yes, you do deserve it. He recommended my post, and then I got ad hoc appointment to Chest Hospital, and then I began my career. This was the first step, the biggest hurdle. The next hurdle is you have not done so many cases. You were the student when you graduated. Now, unless you do cases, you don't get experience. And unless you don't get experience, you don't become a good surgeon. So it's a difficult scenario. But then I started doing small cases, starting building up the cases. Also, I got attachment to the private hospital. So I started doing simpler cases, not difficult cases. So as the days passed, as the years passed, I slowly built up a series where people started talking about me that yes, he does good surgery, he has got good results. And then gradually, I started getting name, cases, and satisfaction. So it was a long journey, difficult journey. Many times after doing surgery, I used to come home. The patient used to have some complication. My wife is doctor and she's very intelligent. I used to come and talk to her. This has happened today and the patient is not doing well, what I should do. So she used to suggest, why didn't you do this? Why didn't you do that? So many times I used to take her advice and try to implement in my next case. So like this, things went on, and gradually all those lacunae which were there, I could fill them up, and my experience increased and cases also started coming to me. So that was a period of 5 to 10 years, mind you. And those times, they were very difficult time. You are not earning so much. There's a lot of family issues. You have got, when you are doing operation, there is a stress. What is going to happen? I'm going to succeed or not? All these things, but things passed. And those years, now I feel that was the greatest challenging time in my life. But it went off without any incidences, without any problems. And I'm so happy and thankful to God that He blessed me during the time when I needed His blessings.
So, you are a blessing to so many lives, I'm sure, sir. When you used to finish the surgery and come home and, not knowing what's going to happen, like you said, it must have been very stressful. So, in your own journey, what are some of the qualities that you have come to think of as being very important for a doctor, a surgeon particularly?
Surgeon has to be very aggressive. Surgeon has to be sometimes ruthless. Surgeon has to, uh, I always think about surgeon. Surgeon is the one who takes failure and success with equanimity.
Hmm.
Because there are, if we face failure and if we get demoralized, then surgeon cannot do anything further. And there is not a single cardiac surgeon who can vouch and say that he has no mortality.
Hmm.
Everyone passes through the same, and then they become experienced, and then they build up the surgery. So surgeon always has to see this. Second thing is he is always a captain of the team. Cardiac surgery, unlike other surgery, is a teamwork. It requires tremendous manpower. Cardiac surgeon, anesthetists, perfusionists, nurses, biochemists, lab technician, microbiologist, physician, cardiologist, ICU, is all, unless you have got a harmony, unless you have got good understanding, unless you have good rapport, things don't work properly. So you have to build a team. And when you build a team, if something happens, you have to take the blame. Don't pass the buck on. There is a tendency, patient dies, oh, the anesthetist did not manage it properly. Perfusionist did not manage it properly. This word goes and circulates. And then if they come to know that you are talking like this behind their back, it creates a very bad impression because they are your team members and they expect that you have a good opinion about them, you support them. But if you talk back like this, nobody can have a good association with you. So fortunately, I had wonderful teammates, which we had till 2000. All these then team separate because everybody gets different opportunities and then we start working in different setup. Not that we had discord or we had different opinion, not like that. They had opportunity. So surgeon has to lead from the front, has to take the blame when it comes, and has to reassure the team, take the team members along. He has to work hard. Surgeon has to do the operation in his mind 100 times before he actually starts operation. He has to imagine what complication can occur. If this complication occur, how will I treat? How will I come out of difficulty? All these things he has to think. That make a good surgeon. Surgeon is not just a big like a carpenter, expert carpenter. No, he has to be creative, he has to be innovative, and he has to know if you are in difficult situation, how to come out. Shouting, yelling in the theater never helps. It vitiates the atmosphere, and people lose the courage and the composure, which is very vital if you have to carry out successful cardiac surgery. So it's an amalgamation of all these values to be a surgeon.
So, like you're talking now, sir, in addition to all the knowledge which you gained as a student, did you have to, do some kind of practice in terms of your mind training also in order to get into this mindset which you're talking about now?
The mindset gradually develops
Hmm.
as you face challenges, as you face difficulties, as you face complications. The mindset develops. You become uh, a person who takes this as a challenge
Hmm.
and you expect it. It's not you start operating and everything goes very smooth. It's a walk in the park. It's not like that.
Yes.
Many times there are difficulties, but those difficulties can be solved. It's not very difficult.
Mhm.
Only thing you have to be cool, think, and do the surgery. And nowadays, because of the technology, I can immediately do a video call to my senior surgeon and I tell him that I'm in difficulty, what I should do. So such facilities are now available.
Hmm.
But previously, those facilities were not available. So if I'm going to operate a difficult case, I used to call my senior. Then I should ask him
Hmm.
what thing I should do not to have any problem. So he used to give me, because he has passed to that stage. He has seen those complications. So they usually tell you how to avoid those complications.
One of the common questions is, why is heart surgery so expensive?
Yeah, I think it's a very common notion, and it's very true also. It's very first true fact. Heart surgery, unlike as I told you, a normal surgery, it's a very difficult scenario. It requires a good setup, first of all. You can't operate a person where the person does tonsillectomy or hernia. It's not like that. You can tonsillectomy or hernia can be done in a small setup. It does not require a very fancy setup. Here you have to have a good AC, good air control, temperature control theater, good filter because he can't afford to have any infection following cardiac surgery because that means it's a great setback what you have done if you get infection. So it is a very properly filtered air is allowed to circulate in the theater. The third thing is you require, as I told you, the members of the team. Anesthetist has to be very good, has to be very experienced, has to know what needs to be done. Because cardiac surgery requires monitoring. You'll ask me, what is monitoring? Monitoring means once you start the operation, before you start the operation, you take the pulse of the patient, you see the blood pressure of the patient, you see the pulse oxygen, the oxygen saturation of the patient. All these things you monitor. Then use special cannulae, which called cannulae, in the vein and in the artery. So that gives you continuous monitoring of the blood pressure and the heart pressure. So these are very vital because you have to keep those very steady. Third thing, you have to monitor patient's temperature. Temperature, certain operations are there where you cool the body of the patient to 18 degrees centigrade.
Hmm.
18 degrees centigrade, you stop the circulation. It is called profound hypothermic circulatory arrest. Everything is stopped.
Hmm.
The circulation continues and it continues to give oxygen to brain, kidneys, liver, other things. But heart is completely isolated and it is cooled to 18-degree temperature. Then you open the heart or the structure and repair it. So it is called as hypothermic surgery. Then you require special nurses. Then you require heart lung machine. Now, heart lung machine is part of cardiac surgery. If you want to open the heart,
Mm.
you have to keep the heart stand still without any blood inside. So, with the help of heart lung machine, the blood is drained out into the machine.
Mm. Mm.
In the machine, the blood is oxygenated, and this oxygenated blood is returned to patient. So the patient body gets oxygenation blood. So the machine acts as heart and the lung. So this heart lung machine, part of the cardiac surgery. Then the perfusionist, the machine is managed by a person who has specially trained in this perfusion technology. It's not an ordinary person who is managing the problem. No, it's a very important job, and he is the important link in your cardiac surgery. So perfusion is there. Then you require a very experienced sister. Now I tell you my story. When I was started doing surgery in multi-specialty hospital, Ruby Hall, way back in 1970, no one was even heard about cardiac surgery. No one ever did cardiac surgery there. So I had to first train the nurses. What is this instrument called? What is this same thing called? Right from there. What is the first step of operation? What is the second step of operation? What I need in the second stage, third stage. The sister was 60-year-old sister, and she was a grand lady. We used to call her grand lady. Very highly respected and always command respect. So we used to be always, when approach and tell her, we have to keep our voice low and explain to her. I was operating, I was doing a valve replacement surgery, which is quite a major surgery. I told her that these are the instruments which I will require at this stage, this stage, this stage. And I gave them the demonstration. This is called this instrument. This is called this instrument. Of course, it is difficult for them to understand and remember also. But in those days, I did not accept that. So when I started operation and reached to that stage where I require specific retractor, that retractor gives me good view of the valve. When I open the heart and put that retractor, I see a good valve. So my sister gave me that retractor. So she gave me some funny retractor. It was a retractor, but it was not the retractor which I wanted. I said, sister, you are giving me scapular retractor. This is not left atrial retractor. He said, no, this is what you gave me. Now, this is during the operation. I cannot discuss, cannot argue with her. So what I did, that scapular retractor is pretty heavy and it is traumatic. In cardiac surgery, we have all the instruments which are called atraumatic. That means they hold the heart tissue or muscle if they will not damage the tissue. So it is called atraumatic. So what I did, I just wrapped the gauze piece around the retractor and used it as a retractor. Because if I would spend time in arguing with her, the operation would have prolonged. So this happens if you have someone who is not trained, who is not experienced. So such difficulties also can. That is beside the point. So point is why heart surgery is expensive is because it requires a lot of paraphernalia. Then after the operation require very high standard ICU, which is called as continuous cardiac monitoring. So the patient from theater is not awake. He is ventilated. That means he has got tube inside. He is breathing on the machine, and he is monitored in the recovery room for first 6 hours. How the heart is behaving, whether there is any bleeding coming from the drains. So all these monitors are seen. During 6 to 8 hours, patient usually wakes up. Then the anesthetist sees how his mental condition, whether he is fully awake, he can breathe properly or not. And then the tube is removed. So the setup is CCU is very essential and it's part of the cardiac surgery. You cannot say that I will not have cardiac recovery. And third is the valve which we have to use are artificial valves or made from animals. These valves cost from 50,000 to 5 lakhs. So these also contribute to your surgical expenses. So the total cost, if you are operating in a private hospital, usually goes from 3,000 to 4,000 for straightforward operation. But if you are having second time operation, valve operation, or any other such operation where you require artificial device, this cost goes on 5 lakhs, 7 lakhs, 8 lakhs. And this is normally if everything goes as per expectation. But if there are some complications and the patient stay is prolonged in the ICU, then every day the cost is more than 10 to 15,000. So this is also a rate. And then people think that surgeons charge more. No, we used to get pittance. Sometimes we had to lose the money also because patient could not afford to pay money. So it's a wrong understanding and wrong belief that surgeon gets more money. Yes, he gets more money. The things are as per the expectation without any complication and does not require any valve or any artificial part. So this is in short why the heart surgery is expensive and you require antibiotics which are so costly. Antibiotics, blood products. So all these things contribute to the cost of cardiac surgery.
So talk to us a little bit, doctor, about the present status of coronary bypass surgery and angioplasty also.
Yeah, coronary bypass surgery is a wonderful, I think, gift to medical to these medical by the medical world to the common people, where heart, which is deprived of its blood because of coronary artery disease. Now, coronary artery disease is what? Narrowing of the coronary arteries. Coronary arteries supply blood to the heart and supply oxygen. Heart is continuously working, so it requires oxygen all the time. If it does not get oxygen, then it becomes weak or it starts complaining or it starts giving signal. Okay. Coronary artery disease is very important disease of the heart and it is increasing in incidence in India and it has become an epidemic proportion. Diabetes, hypertension, smoking, tobacco chewing, and bad health habits, stress, alpha personality, all these are contributory factors to lead to coronary artery disease. Now, what happens in coronary artery disease? The blood supply to the heart progressively becomes less because the arteries get narrowed because of accumulation of cholesterol and other material. When the process is gradual, usually start getting signal, the pain, difficulty in walking, fatigability, like that. But when it is sudden, when the blood supply is suddenly cut off, the person instantaneously dies because the heart stops. And unless patient can get immediate treatment in the hospital, there's no chance of survival. So this is acute coronary event where the coronary is blocked, no blood supply going through the vessel, and the person dies. On other time, there is a progressive disease, people get symptoms and they come to the cardiologist. Cardiologist investigates. Then they do ECG, exercise test, and then they do coronary angiography. Coronary angiography gives you complete picture of the coronary of the heart. and they show whether there is a critical blockage of the coronary artery. Now, when there is critical blockage, you have got two choices now. One is coronary artery bypass or angioplasty. Coronary artery bypass surgery started way back in 1960, and it has been proved over the last 50 years that it improves the quality of the life, it improves the longevity of the life, it minimizes the drugs, minimizes the acute episode of cardiac arrest or cardiac heart attack. So coronary bypass surgery has become a very standard operation everywhere in India, and all surgeons are equally efficient, skillful, and experienced to carry out this operation. So this operation is very effective and very useful. As opposed to that, there is angioplasty. Angioplasty is not surgery, but dilating that coronary artery by using technologically made available equipment. It is a long catheter which has got a balloon at the tip. That catheter is passed through your blood vessel in the groin and it goes to the heart and enters the artery where there is a block. So it negotiates the block and then they inflate the balloon so that the blockage is completely broken. The arterial passage is restored, but to keep that passage open, they keep what you call as stent.
Right.
Stent is like a coil. That coil is kept at the side where there was previous block. So the artery does not compress again, it remains patent. Now there are a variety of stents which are called drug-eluting stent, where there is a drug which prevents the accumulation of thrombus, so it does not cause blockage. And many years they remain patent. Now this has become very effective for people who are very young, because we have seen patients 28 years, 30 years, 40 years coming. So if they are young, if there are one or two vessels, angioplasty is a good modality of treatment, effective treatment, and as good as coronary bypass. So people ask, which is good, coronary bypass or angioplasty? You merit and demerits. Coronary bypass surgery is a proven treatment in the treatment of coronary artery disease. There is no second opinion. There are meta trials which has proved beyond doubt that survival and quality of the life, everything improves. So there is no, but person has to undergo surgery. There is a fear in the mind of people. Some surgeons, cardiologists, well, they cut your sternum, open your chest, and then they do surgery. That fear is aggravated, enhanced by such advice. But that pain is so little, the patient doesn't even experience the pain after the surgery. He is so comfortable because of many things. So that is the second thing. So angioplasty is advisable if the person is young, if the person is diabetic, if the person has other factors such as very obese, kidney, respiratory disease, kidney problem. So it is better to have angioplasty. But if patient is otherwise fit and there are multiple vessels which are involved, coronary bypass surgery is good. But everyone has to weigh, and I always say that if you have got mind, question in mind, or any doubt in mind, take second opinion, go to other surgeon, go to cardiologist. Don't take first advice as a gospel. You can wait, go to other cardiologist. This is the best way to do. If you have got slightest doubt, go to other surgeon, go to other cardiologist, say that what is the best for me. So cardiology, CABG and angioplasty are two important modalities of treatment and best treatment, and they have done wonderful sort of magic in treatment of coronary artery disease.
So you were just talking to us about this, and you said at one point of time that sometimes there is intense pain, and then so when someone gets a heart attack, have you ever had that kind of an experience of being in a situation where you were the doctor and somebody's life was in danger?
Yes, I always say this. This happened. This happened somewhere in the aeroplane,
Mm.
and a person was one of our fellow travelers. He had gone to Scandinavian countries for a tour, and he was our elderly person. He was 77-year old, and we were com- commencing our last leg of journey from Istanbul to Bombay. Our plane left Istanbul at 8 p.m. Then we had dinner served at about 9:30. And 11 o'clock, everyone was relaxed and the air hostess switched off the light. The people were just chit-chatting or started dozing off. My colleague, that elderly person, was sitting few lines ahead of me and he was talking to his wife. So during the conversation, that fellow just dropped his neck on her shoulder.
Mm.
So she asked, what has happened to you? Are you okay?
Mm.
So he said, didn't say anything. So she again asked, and he did not reply, could not reply. So she started suspecting something because she's quite an educated lady.
Mm.
So just next to that lawn, another colleague of ours, who is also a doctor but pediatrician, was sitting there. So she requested, doctor, please see what has happened to my husband. So he said, call Dr. Bhate. And he immediately sensed that he had some problem. So called me. There was an announcement on the public address that there is an emergency and Dr. Bhate should immediately rush. So I went five or six lines ahead of me. And I saw that man was lying. He was not responding, he was unconscious, not breathing. There was no pulse. So these are the cardinal signs. But when a person has no pulse and he is not breathing
Mhm.
and he is not responding, that means he has stopped, heart has stopped. So immediately shifted him, brought him to the pantry area, put him on the ground, and I told them, I'm a cardiac surgeon, I know what is to be done. You just help me, give me the necessary things. It was Turkey's airline. And believe me, they had all the facilities, all the medicine, and machine also to give shock to the heart. So I started giving cardiopulmonary resuscitation. That is a measure where you kneel by the side of the patient and start pumping the heart by compressing on the chest. So as if the heart is being compressed and you are trying to give circulation to the body. It's trying to keep the other organs alive and the brain alive, like compressing heart. So I continued for 25 minutes, continuously giving cardiac massage. Then there was another doctor, she was an anesthetist, was coming from America. She held the mask, started oxygen. I gave injection in the heart, it's called cardiac adrenaline, and started massaging. And then I asked, do you have defibrillator? Defibrillator is a small machine which is always kept on the ground in the strategic location, in the hotels, five-star hotels, airport, wherever there is a crowd, they keep this machine. If the person has got heart attack, he can be revived. So they had a machine which was working condition. So they brought the machine, I gave him shock, and to our great surprise, heart started beating. So I started feeling the pulse. The moment I started feeling the pulse, the person started breathing. Initial breathing is jerking breathing. They do like that. It's like the trying to take as much air as possible. Because they are hungry, air hungry. So they start breathing. So gradually his respiration started improving. His oxygen saturation, which was some 50, 60, started becoming 70, 80, 90, and then steadies at 95. It was a very good indication that heart and lungs started working. So the pilot asked me, our next Bombay stop is at 4 hours away.
Mhm.
And immediate stop is in Karachi, which is 15 minutes away. So what should we do? I said, wherever is the earliest, we have to land because this condition may not uh, remain like that. It is always, patient is always in unstable situation. So earlier he reaches to the hospital is the best thing. So the pilot asked permission to Karachi.
Mm.
Our plane landed at Karachi airport. The patient was shifted to Karachi Hospital, Heart Hospital, and there investigations were done. Fortunately, this patient did not have coronary artery disease. He had very rare condition called as cardiomyopathy. That means part of the heart has become thick and enlarged, and that causes heart arrhythmia, which is called severe arrhythmia. And that was the reason his heart stopped because he developed cardiac arrhythmia.
Mm.
So this was very rare. It has never happened so far that the person who was suspected to have heart attack has been resuscitated successfully in the plane. So this patient came to Bombay, then 4 days later, he got implantation of defibrillator, which is a small machine which is implanted in your under the skin.
Mm.
And then that machine keeps watch on your heartbeats. If the heartbeats become irregular, it gives a shock. So restore the normal. So this man survived till last month. So 84 till 84 he survived. This was a very, very rare episode in my life that my CPR helped the person to survive. So I always say this CPR is one important thing each and everyone from the society must learn. And it's very easy to give.
Mhm.
It's not difficult. But if you get practical demonstration,
Mm.
then it helps you to give proper. So you should know where the person, whether the patient has got heart attack, or he has got epilepsy, or he has got some brain problem. To know that is very easy. In all other things, pulse, if you feel here, the neck, you will feel the pulse if the heart has not stopped. That means this is not heart attack.
Mm.
But if you do not feel the pulse and person is unconscious and is not breathing, this is heart attack. So once you know the heart attack, immediately start cardiopulmonary resuscitation and call for the emergency cardiac ambulance, because cardiac ambulance are always fitted with all these gadgets. So you can properly take the action. So this
That's
was
something all people can learn. You don't need a medical background for it, right?
yes. No, they don't have to have medical background. No, each and every person, whether he is medical, non-medical, doesn't matter. It is very simple. He should be educated. That is the only thing. So he knows where to feel pulse, where to feel this, all
Right.
these things. No, I mean, it's something which is very peculiar, I always tell it. Somehow or the other, I have been involved in giving this CPR in 3 to 4 occasions.
Mhm.
One occasion was when I started my practice. Very soon started my practice. I got a call from Dr. Sanjay, the orthopedic surgeon, that there is a person who is on the table and he has got cardiac arrest during anesthesia. So rush immediately as you are. So I reached there in 10 minutes time. I went to the theater. The patient was anesthetized. So I did not spend time in giving open massage. I opened the chest. And give open cardiac massage. And with open cardiac massage, heart immediately revived. So that person happens to be the father of 2 greatest Maharashtrian singers, So those sisters ask him, Baba, why you have got this mark? So he says, go and ask Dr. Bhate what happened to me. Then third thing happened on tennis court. About 2 years ago, one of my tennis colleague, after finishing the tennis, suffered heart attack. And I gave him cardiac massage and took him to the nearest hospital, massaging all the time. We did everything, but he could not survive. He had massive blockages of the coronary arteries. So surprisingly, I happened to be the person involved in giving cardiopulmonary resuscitation. So two of these people have survived. One fellow has died.
If in an ordinary setup, if someone seems to have got a heart attack, what is it that a common person should do? What are some of the things? Of course, in addition
Common
to
person,
calling an
common
ambulance.
person has to, as soon as he diagnoses that the heart has stopped, start giving massage. But you have to make sure that heart has stopped. And that you can make out by feeling the pulse over here, just below the angle of the mandible here. Here, if you feel your two fingers, you can feel the beat of the pulse. So if the pulse is not there and person is not responsive, start cardiac massage. And immediately call for the ambulance because you cannot do anything else there.
So, in addition to all the information you have shared, doctor, please do talk to us about some tips for a healthy heart.
Oh yes, I think that is most important thing. Nowadays we have seen people suffering heart disease at a very younger age, and it is very distressing to see. But large people can't suspect, and he happens to have cardiac problem. So one has to be very careful. So the causes cardiac causing this coronary artery disease. There are many heart diseases which we are not concerned now. We are concerned with important disease, this coronary artery disease. Usually, this disease was supposed to affect the heart after 50, after 60. It is supposed to be people started getting old. So it is a degenerative disease. Starts affecting the people when they become old. But it has totally changed the way it affects now.
Mm-hmm.
Now the various studies have shown that what are the different factors that contribute to the heart disease. The one I told you is your genetic history. If your father and mother, they have genetic, they have cardiac problem, then you are likely to have cardiac problem. And you have to take extreme care how to avoid that cardiac problem. So genetic makeup. So you must know whether your family history, someone has cardiac problem, someone has died, someone has been treated or not. Second is your body constitution. Now, we always say exercise is one of the important things that parents should consider to nurture in their growing children. Habit of doing exercise. But because of our changed lifestyle and because of everything has changed, boys do not find the time to do the exercise. Even they don't have much time to play in the school. They are so overworked with studies and commitment, other commitments. So exercise is a very important thing which you either do at home or on the ground or somewhere. 1 hour or half an hour, some fast paced walk, or if you are young enough to do walk or swim or uh, any other exercise, any other activity that involves, say, Namaskar, Surya Namaskar is another good activity that you can do. Then skipping, that is another good activity. Swimming is another good activity. Cycling is good activity. So some exercise is mandatory. So body, keep your weight. I'm surprised Many parents just ignore the boy putting on weight. He has got a tummy, he has got thick fat thighs, and his weight is not normal for that age group. So they don't take care. If you don't take care, weight cannot go down by soon.
True.
You can add to weight, but you can't reduce the weight without doing some definitive exercise, activity, diet, and everything. So keep your diet and keep your weight in check. So parents have an important work to do. Third thing is, if your parents have diabetes, if your parents have obesity, again, it is a genetically linked disease. So you are likely to have obesity, you are likely to have diabetes. So start taking care right from your childhood, right from adulthood. Third, school smoking, chewing tobacco has become very common, and people just don't care. If you tell them don't smoke, they don't listen. Don't chew tobacco, they don't listen. So this is a very, very bad habit, injurious to your health. So they have to be away from smoking, alcohol, tobacco. Fourth thing is diet. As far as possible, try to eat homemade food rather than going for fast food. So homemade food is nutritious, does not add too much fat. That is fourth thing. Fifth thing is your job. When you start your professional career,
Mm.
your job is very stressful. There are interactions, there are weightage of your workload, and all these things, and beside the family problems. So you are in a vortex of all these things, and that can damage your health.
Mm.
So try to minimize stress. How to minimize stress? Accept that stress is going to be there. So how I can counter stress? Do breathing exercise,
Mm.
do pranayama, do quiet sitting for some time,
Yes.
and just try to vent your anger, not on family members, friends, or anything. Go anywhere and shout. Venting your anger by crying, shouting, or if you are extremely irritated, loudly laugh.
Mm.
All these can de-stress you and help you to reduce the stress in your life. And well, I think these are few of the things that we have to observe to have a good lifestyle.
There's a lot of information which may or may not be true, but since we have the opportunity, what is the relationship of alcohol to heart? Because sometimes you read contradictory things.
See, pharmacology of the alcohol is such that methyl alcohol, not methyl alcohol, when it's taken in a physiological amount. Now, one has to decide what is physiological. It causes it causes beneficial effects. That means your blood vessels dilate, your heart action becomes stronger, your brain has got a soothing effect, and total you feel relaxed. But as you start adding more quantity of alcohol, these good effects are negative. So then they start to suppress your consciousness, then you behave in a different way. Then large amount of alcohol is damaging to your liver, damaging to your kidney, damaging to your gastrointestinal tract. So people say, what is the normal amount? What I must understand? See, it is very difficult to quantify how much alcohol you should take. One peg alcohol is a classic example of medicinal alcohol. That means you take one alcohol, it is like drinking one glass of water. It is very helpful, effective. But if you increase the dose of alcohol, it is not good. Then you become addictive because alcohol has produced some sedative effect which you like to have. And that effect, one peg will not produce that effect. As you start taking one peg, effect don't come, effect doesn't come. Then you take two pegs. For some days you get effect. Again, it becomes used to that dose. Then you have to increase another dose. So incremental addition happens, which is not good. That causes ill effects right from stomach, esophagus, and gastrointestinal tract, liver, kidney, brain. So if one can moderate, and I always say moderation in everything is the best thing. Madhyam marga, as Gautam Buddha said.
Hmm.
Follow Madhyam Bhav. Don't be on the right side or left side. If you follow Madhyam Bhav, you will be always happy.
So it was so wonderful talking to you, sir. Is there a message you have from your community of surgeons for the general public?
What I would say that people have to little bit aware of heart problems, what symptoms it produces, not to ignore those signals. I've seen people have just taken it so casually and they landed up in a massive heart attack. No, your body always gives you signal and don't hesitate to go to doctor. Whenever I have recommended that if you are 40, if your job is stressful, if you have got incremental risk factors like you are obese, you are diabetes, or you are occasional smoker, then you should get, it's like your Patrika, Janma Kundali, go to doctors, get everything done, blood profile, ECG, the stress test, and if stress test is normal, don't go for coronary angio. But if stress test is doubtful, get your coronary angio, which is called a CT angio done. So that gives you a picture whether your coronaries are normal, whether your heart is okay. Because I have seen my own colleague, Dr. Nitin at his pinnacle of career when he was building Ambani Hospital. In spite of telling him, Baba, you just get investigated because you are just 52, you are building these crores of rupees in building, pouring in to build a machine hospital. He ignored it and he got a heart attack, and that was a massive heart attack. So we have to be careful about our life. Do not compromise. When you are 40, take this advice, go to Dr. Cardio, tell him that I want to have full investigation. People say, no, doctors unnecessarily make money. Money, but at the cost of what? You are losing your life otherwise. You have to feel safe. When you feel safe, that you have this, your kundali is okay. There is no warning sign there. So you can go make any proposal to bring to make some investment or to buy house or to buy property or do something like that. So always at such juncture, you should have this thing available. Second thing is people call doctor at home, chest pain. Doctor, please come and see my mother or my father has chest pain. No, when you have got chest pain, the first thing to do is rush to the hospital, nearest hospital. Do not waste time. This is a golden hour where reaching hospital is very, very important. Then calling doctor and then he's coming, checking blood pressure, doing ECG, and now yes, it's your heart problem, go to the hospital. No, don't do it. Go to the hospital. And third thing is be careful about your living style. Always see that you monitor your body in a way you should monitor that weight is proper, exercise is proper, and you do your health check frequently. Health check frequently is not spending money unnecessarily. You go to the mall and purchase something which is not at all useful, and you try and hesitate, you spend some 2-3 thousand rupees to give to your body check. That's, I think, irrational. So always reaching 40 and you are having risk factors, do your body check every time. That is very important. So I would say that in short, heart is very, very important organ in our body. If you keep him healthy, he will keep you healthy. And if you ignore health of the heart, you will ignore your health.
Yes.
So everyone should be aware of it and
Right.
should be mindful that heart is important and is a God in our body. Keep
Yes.
him always happy.
Also, I would like you to talk to us a little bit about you're not actively involved in surgery anymore, but you're doing something very beautiful and wonderful
Yeah,
for.
yes,
Yes, talk to us about.
yes. My son is also heart surgeon, and we together have decided that we should have something like a trust, which will help to spread the awareness about heart health. So we call Heart Heart Foundation. Heart Foundation is our trust. With the help of this trust, we are holding camps to diagnose people whether they have got any heart ailment. When we started giving lectures like this, and I have in my mind to go to as much available and as many people available to spread this message, to go to the school, to go to the college, to go to the Rotary Club, whatever, to spread this awareness. Third is to help poor people to get the money, to give them proper guidance. And fourth is, I have decided to give second opinion. Many people come to me, ask me, Doctor, you have operated me, now give me an opinion. So I I enjoy that because second opinion many times helps.
Yes.
Some time ago, a person came to me and said, this is my angiogram. And one fellow suggested to undergo angioplasty. So there was angioplasty was not necessary because that was not a major issue. So this also helps. So, with the help of our heart from the trust which we have established, we want to spread the awareness about the health of the heart. And as much people as we can reach, we are going to try. This, I think, will help because my son is presently working at Bangalore in a Sparsh hospital. He is in charge of the heart transplant and lung transplant plus cardiac surgery. So now transplant is becoming another important modality of treatment in heart diseases. But our in India, as well as in outside world also, there are many patients who require heart transplant, but there are few donors available. Now these donors are brain dead donors, mind you.
Yes.
Once they have made accident and their brain is completely damaged, no chance of recovery, then they are declared as a brain dead. But that is a living donor, and you have to remove the heart when the person is living. So remove the heart and use that heart for a person who is waiting for heart transplant. So he is in charge of that unit. So they go to different places, collect the heart, and do the transplant. So heart transplant is another important modality of treatment. So I am the witness to a variety of transformation of the treatment. As we started, it was initially only closed heart surgeries. Without opening the heart, we have to do surgery. Then became the open heart surgery when the heart lung machine was available. And now people are operating on a beating heart. That means the one which we were doing previously on a still heart, now they do on a beating heart. So variety of modifications are happening and it is changing. And now the next step is the robotic surgery. So this is the next step of miniature cardiac surgery. But it is in the process of development. And technology is always in the process of evolution. So you start getting different technologies that add simplicity and make your job simple.
So, I
Before
want
I
to make,
close,
yes, please carry on.
I just wanted to give you one example, and then I always tell to my undergraduate and my students that surgeon is not like a carpenter, that a job is given and this is two job. Many times job is also creative. Carpenter is also creative. But I always tell surgeon has to be creative. Creativity, if we find, is lacking in most of the surgeons, unfortunately. I don't know why. And one example I will cite, when himself he has written this paper, are cardiac surgeons creative? It is written by a Canadian surgeon.
Mm-hmm.
So he says that to become a creative person, any aspect, whether you are surgeon, writer, poem, or an architect, anywhere, first you have to master your domain. Suppose I'm a cardiac surgeon and I'm operating on the valve, mitral valve. I must know each and every aspect of mitral valve surgery, each and every aspect. Similarly, if I'm operating on some different thing, I should be master of them. So it is called domain specific specialization. You have to have complete knowledge about domain. Tomorrow, if a beggar starts thinking that I want to think about novel idea about how to sing, he cannot. A singer who has mastered classical music or other music, if he has studied detail, then he comes out with symphony or classical, and that also comes spontaneously because he has studied so much. So this surgeon says that once you have studied the subject thoroughly, then you are all the time thinking about new things. And sometimes the idea comes, you have to catch that idea. So he gave an example.
Yes,
He was
please.
operating on an old lady. That old lady had to undergo second time operation. She was 70 plus. She had all the bad things the surgeon should avoid or should not have.
Mm-hmm.
We should not face. She elderly, fragile, then the heart was very enlarged, and the valve had thick substance which is called calcification. So his name is, that surgeon's name is Tyrone David. So Tyrone David, when he saw the case, he in the mind thought, what problems I will have about this case. One is opening the chest, I might damage the heart. So what precaution I should take? Then he said, after I open and after I reach the valve and I remove the valve and put the valve, what can happen? I might tear the part of the heart during removal of the heart substance. If that happens, what will I do? I will have to repair it. How will I repair it? So I will put a patch like this because this complication has happened in other patients and they try to repair from outside and no, not a single patient survived. So with this set of ideas and information in mind, he went to operate. There were few visitors because he is a very famous surgeon. They were watching him. He finished the operation as he was a very dexterous surgeon, finished the operation. He was closing and he saw a pool of blood coming. And he did not understand how so much of blood coming after he has finished the main operation. Immediately realized that there is a tear of the heart. So without thinking further, he immediately repeated all the steps that he had planned in his mind, took out the valve, took the patch from inside, again took the valve, and finished the operation. The lady did well, recovered. When those visitors asked him, did you do it fever? No, this was the first time I did operation. Now, how come? So let's see, say that surgeon has to be creative. And this creativity doesn't come on the table. I thought over it for a long time.
Yes.
What I should do if I make this complication. So, to be creative, one has to have one thorough knowledge of the subject. He has to be in the right place with the right people and the right ambience. You know why Florence became the best city in Europe? Because after Renaissance, the mayors of the Florence opened the gates of Florence city
Hmm.
to call anyone to display their art.
Hmm.
So there were architects, there were carpenters, there were sculptors, everyone came there because they opened the gates and they supported them. So Florence became a beautiful city in Europe. There was beautiful fountains, beautiful churches, beautiful building, beautiful wall painting. So this happens if you have all these things together. So creativity takes place. So to get creativity and to get some spurt of idea, you have to have all these factors there. Creativity doesn't happen just like a bolt of
So true.
lightning to any person. That always I tell my students, be creative. And to be creative, work hard. Get the knowledge of the subject thoroughly. I think that's all.
No, I really have to ask you this question now, sir. Please share with us an experience, in which you became creative at this and it saved the day.
No, that I can't say that was creativity, but it has happened twice to me that, as I told you, that I had to use a retractor which was not supposed to be used. So I used the gauze, wrap around, and use as an instrument. It was part of creativity because I could handle that situation. I could get proper retraction, finish my operation. But then at the end of the operation, I told sister, this is the retractor which you need. This is the retractor you don't need. So such examples are far and few, but that was because I had in my mind worked on this. If this happens, what will I do? This problem I did not anticipate. But because I know that all the instruments, how they are, I knew every aspect of instrument.
Yes.
I could immediately use my knowledge about it.
Sir, you have been in and out of the operation theater for so many occasions, on so many occasions. But for a lay person, when you're the relatives who are standing outside and the surgeon comes and goes in, he's like a god. What is going on in your mind, when you're going into the operation theater?
It's a very good question. When the operation is finished without any hitch, we go with smiling face. Oh, come on, come on. Then we tell them also, call many people also. Operation has gone well, everything is good, but we always caveat. We say 24 hours following surgery, always critical. Anything can happen. But 99% has gone well. So we have got a smiling face, white green, and very happy to tell. But when something has gone wrong, then we have to have courage and we have to have strength to go and face the music. So we have to tell what has happened. We have to tell them, and I usually, all these days, used to call patient close relation rather than calling Tom, Dick, and Harry, who unnecessarily create a problem because they don't have any understanding about what is the patient was happening, what patient was having, how difficult was the operation. They just come there to show that they are someone, and then they ask you some questions, nasty questions. So I don't entertain them. So I always tell them that you are the relation. Yes. So I will always talk to you and nobody else. So I call them. I tell them what has gone wrong and what we expect, what can happen if there is a chance of recovery or not, whether this will take little time to recover, all these things we have to see. So, and we preferably record it on a video because that stands as a proof that we did not hide anything. We told them anything. So you have to face the music. When everything is good, you are laughing. When everything is not good, still you have to build the courage and go and start.
I'm so tempted to keep asking you more questions, sir. What is your philosophy of life?
Oh, that's a wonderful question. I am really a philosophical person, and I believe that it is whatever is in your destiny, it happens. There is a very beautiful Sanskrit shlok which I always say. It says, Sukhasya dukhasya na kopi data. Karo dadhami iti kubuddhilesha. Aham karomi iti vruthabhimani. Swakarma dharmena gatitopi loka. Means sukha or dukkha. It's not that you have done something and you got sukha, or you have not done something, that's what you do. No. It is in your karma, which comes to you whether you do good thing or bad thing. But I have done this, and that's why I'm now like this, is a wrong thing to say. You are no one. You are just instrumental in doing the thing. Whether it is a good thing, whether you are going to get good fruit or bad fruit, it depends upon what you have done. So never ever boast that you have done something good or bad also. Let it be your karma. And whatever is destined, you will get it. Sukhasya dukhasya na gopidana. As they say, karmanya varika svaste, na phaleshu padacha. Only something like that. As I grow, I started becoming Sthita Prajna. There is a very beautiful translation by Sridharan, the man who did Metro and Konkan Railway. He has translated one Gita Shloka. What he said, not unduly exhilarated by praise, not unduly exhilarated, unduly distressed by criticism, not truly framed, not truly full of enemy, bereft of hate, anger, anxiety, and envy. So it is that when you become Sthita Prajna, all these things just leave. Prajahati yada karma sarvam partya manogata atmanye vatmana tushta Sthita Prajnastu dhammastu. So this is Sthita Prajna I have reached at the age of 80 after having gone through the journey of that whatever you want to get, you will get it. Whatever you are not supposed to get, you are not getting. Be calm and be steadfast what you are doing. Try to do good things. Good things come back to you. And bad things also come back to you. Yes.
Yes.
So this was, I could share with you.
Thank you
Thank
very
you
much,
so
sir, for being on Ek Samvad. It was such a privilege having you here, and I'm sure we have so much more to talk about, but we'll have to conclude this Samvad here. Thank you very
Yes.
much. Thank you, sir.
Thank you very much. Thank you very much for giving me this opportunity to
Oh,
share my thoughts. Thank you so much.
it's an honor, sir. Thank you.